Hi everyone, welcome back to your Logic Health channel. Today we're diving into a mineral that many people don't pay enough attention to, magnesium. And you'll be surprised at how important it is for cardiovascular and stroke risk, especially in the US and Europe. Let's get into it. What is magnesium and why it matters? Magnesium is an essential mineral involved in over 300 enzyme reactions, muscle contraction, nerve function, vascular tone, energy production, DNA repair. Although we often hear about calcium, potassium, sodium, magnesium gets less spotlight. Yet emerging research shows that low magnesium status is linked with higher risk of high blood pressure, diabetes, metabolic syndrome, vascular calcification, and stroke. For example, a recent 2025 study in U.S. adults using the Magnesium Depletion score MDS found that higher MDS worse magnesium status was associated with nearly doubling of stroke risk and about 2 cardiovascular mortality versus those with low MDS. Many adults in Western countries have suboptimal magnesium intake status. Food processing, dieting trends, medications, PP is diuretics and lifestyle factors reduce magnesium absorption or increase loss. So, even though magnesium deficiency doesn't always show dramatic symptoms, its subtle effects can build up over time and affect cardiovascular health. Latest evidence from USA. Europe, the study I just mentioned used data from NHANES 1999 to 2018. 44,500 U.S. adults and found participants with high MDS score 3 to 5 had odds ratio approximately 1.96 for stroke versus MDS 0 to 1. They also had hazard ratio approximately 1.73 for all-cause mortality and approximately 2.01 for cardiovascular disease CVD mortality. Another 2025 clinical guideline review emphasizes that magnesium deficiency is underdiagnosed in ambulatory care settings in high-income countries, yet is associated with many chronic conditions: hypertension, diabetes, osteoporosis, inflammation. In Europe, a large cohort found that although the association between magnesium status and vitamin D status was modest, the fact so many adults were magnesium insufficient indicates a population health issue. Bottom line, from both US and European data, magnesium deficiency or suboptimal status is showing up as a modifiable risk factor for vascular health. Signs, risk factors, and groups at risk. What might low magnesium look like? Some possible signs: muscle cramps, spasms, fatigue, irregular heartbeat, restless legs, sleep problems, increased blood pressure, migraine, anxiety. Note, these are non-specific. Risk factors for low magnesium include poor dietary intake, processed foods, low whole grains, low legumes, medications, nuts, seeds, proton pump inhibitors, PPs, some diuretics, some chemotherapy, heavy alcohol use. Conditions which increase loss: uncontrolled diabetes, chronic kidney disease, mild impaired kidney function counts. Lifestyle: high stress, low physical activity, high consumption of sugar, refined carbs, perhaps low magnesium soil content in food supply. So, if someone is middle-aged or older with hypertension or early vascular disease or multiple risk factors, magnesium status may be a hidden area to check. Practical actions and guidance. First, encourage viewers to speak to their healthcare provider. Magnesium status isn't always routinely assessed, and supplementation should consider underlying kidney or cardiac conditions. Dietary guidance. USA, Europe friendly. Increase intake of magnesium-rich foods, green leafy vegetables, spinach, Swiss chard, nuts, seeds, almonds, pumpkin seeds, legumes, black beans, lentils, whole grains, brown rice, quinoa, fatty fish. Reduce factors that impair magnesium, minimize heavy alcohol use. Review medications with physician. PP is diuretics, reduce ultra-processed food intake. Lifestyle supporting magnesium: regular moderate physical activity, adequate sleep, managing stress. Chronic stress may deplete magnesium, maintaining healthy weight. If supplementation is considered, forms like magnesium glycinate or citrate may be better absorbed than oxide. Consult provider. Also emphasize that magnesium is part of overall cardiovascular risk factor modification. It complements, does not replace established strategies controlling blood pressure, cholesterol, glycemia, smoking cessation, physical activity. Key points: magnesium deficiency or suboptimal status is common and under-recognized in USA and Europe. Recent data tie worse magnesium status using MDS to higher stroke risk and higher cardiovascular mortality. Simple nutrition and lifestyle actions can improve magnesium status and may contribute to cardiovascular health. Encourage your viewers to mention this to their healthcare provider and consider magnesium in the context of vascular health, especially if they have risk factors. If you found this helpful, please like the video, subscribe to Be Your Logic Health channel, and share it with someone you know who is working on heart health or vascular risk. Don't forget to hit the bell icon so you don't miss future updates. Thanks for watching. Stay well, stay clear-minded, and let your biology work for you, not against you. I'll see you next time.